of the AstraZeneca coronavirus vaccine. The decision comes after a small study found the vaccine offers just limited protection for people with the South African variant of COVID-19. The country's health ministry says it's awaiting clear direction from experts before it proceeds with inoculation. In the meantime, vaccines developed by Johnson & Johnson and Pfizer will be used instead. Well, for more, I'm joined now by Dr. Bharat Pankania. He's a senior clinical lecturer at the University of Exeter Medical School. Thanks so much for being with us. Our hope was that all the vaccines approved for use would cover new variants as well. So how concerned are you now that that's not the case?
I'm just cautious, but I'm not very overtly worried. Look, the key message was it protects against severe illness. And severe illness often results in death. Therefore, there is everything to play for and everything to be optimistic about. That is, the AstraZeneca Oxford vaccine protects against severe illness. If you get a mild illness, you may become infectious and transmit it to others, but at least it protects you from having severe illness and potential death. So it's not all lost, not at all.
Okay, that's good to hear. But still, there's an issue of, delays in rollouts. So how far behind are we globally in these vaccination campaigns? And are these delays potentially giving the virus more time, to mutate and build resistance?
Yes, so you touch on a very, very important global issue, which is vaccine nationalism. So if we do not get our act together at a global level and start distributing vaccines globally, because the whole idea of preventing the emergence of variant strains is to suppress infections. You don't just suppress it in your country, you suppress it globally. So failure to suppress it globally equals you may get variants, and these variants can set back the hard work you've done of already immunizing your population. So I would want the World Trade Organization, the WHO, the European Union, the United States, all to get together and say, we got to build plant under license and royalties and manufacture a lot more vaccines and give them out as quickly as possible.
Okay, Doctor, I've asked you this before, but circumstances do continue to change. So do you have an end in sight?
Well, of course there will be an end in sight, because all pandemics eventually wear themselves out. Unfortunately, this one is doing everything that we would expect in a textbook and more, which is so unfortunate. But in a way, it is testing our resolve. It will get better. We've just got to be patient.
Okay, Dr. Bharat Pankania joining us there. Thank you, as always, for your insight.
Thank you.